86% of the world population increase is happening in developing countries, and it's slowing their rise. How can you develop if you've got too many people? Our challenge has been to transform a negative, no pregnancy, into a positive, contraception. Some people see that to help women's reproductive health in the feminist and human rights sphere. Others are worried about rapid population rise in developing countries and want to break the poverty cycle, not perpetuating aid as hand-to-mouth welfare. But others can see climate change is impacting now. We aim to attract all of these interests and to persuade people that they are interconnected. We can make a difference. What we do is provide actual family planning on the ground. We don't just tell people what would be a good idea. We do it, we make it possible for them. And when overseas aid agencies see that it makes a difference, that it helps all of their programs, then we hope that it will take off and become the norm.
Thank you to Women's Plans Foundation for inviting me along here to this glorious women's club, so thank you. So welcome everyone to Evolve to Solve, Family Planning in a Climate of Crises. I am, as Alice says, the Medical Director of Family Planning New South Wales, and it's been my great privilege to work in this hugely rewarding area of sexual and reproductive health and rights over the years, about 20-something years I have to say, and of course this includes the pivotal right to contraceptive choice, which is crucial for women's empowerment, especially for those who are most marginalised, including adolescents who can then complete their education and join the workforce, for women in remote areas, and for women who lack the power in their relationship to actually make their own choices. Recent research estimates that even a 10% drop in the use of contraceptive pills, implants and IUDs due to COVID would result in an additional 49 million women around the world having an unmet need for modern contraceptives, 15 million more unintended pregnancies, and 3 million more unsafe abortions over a single year. It's also estimated that an additional 15 million cases of intimate partner violence will occur for every 3 months of lockdown and stay-at-home policies in 2020. We've also seen training and mentoring being delivered innovatively and effectively by virtual technologies as well to healthcare practitioners in remote areas of the world. And this is something that was previously unachievable, where it involved travelling long distances, often for days, often in boats for weeks sometimes, to attend a face-to-face contraceptive workshop, for instance, taking people away from their day-to-day lives and their families. But of course, we have to remember that technology cannot completely replace face-to-face human interactions, and we can't ever blindly implement it as a cost-cutting exercise. We must ensure that these innovations are effective and safe and sustainable, and in particular, they are what women themselves want. It's no good delivering care via telehealth if the telecommunications infrastructure is unstable or unaffordable, or if women actually have very poor digital health or digital literacy, so they don't know how to use computers and phones, for instance, and particularly for older women. And we know that for women experiencing domestic violence, finding a safe space to talk on the telephone without being overheard or intercepted by a potential perpetrator can be a great challenge. So it's absolutely essential that the voices of women and girls themselves are embedded in these evolving solutions. I do know that tonight's special seminar will prompt us all to consider how responding to crises, including through the innovative use of technology, can and will build resilience and strengthen health systems, and certainly will give us all hope for the future. Because of course family planning can be and must continue to be incorporated as part of health delivery, even in the time of crises.
So we run a number of in-depth programs, and we work with colleagues that are here in the room. We work with both Murray Stokes and Family Planning New South Wales or Family Planning Australia. And we bring healthcare workers in from very remote parts of PNG, and we upskill them and provide them with the skills to provide family planning counselling and choices to the women of Papua New Guinea. So we like to think about, I guess, 3 dimensions to the work we do. We work with partners, so some I've just mentioned, but we also work very closely with local health service delivery partners. So often that's government, sometimes that's church services. And we all focus on providing access to health rurally. Demand and supply. So on the demand side, Devlin, who you'll speak with shortly, she works with and in communities to create a safe environment and demand generation for health, including support for family planning. We provide public health education, and we seek out to provide information on gender equity, address domestic violence issues, and also child safeguarding. We provide information on reproductive and sexual health, and we go into high schools and schools and provide that to teenagers as well. Then on the supply side, it's very challenging in PNG to actually get implants down to that health post that is 12 hours by 4-wheel drive and banana boat. So what we have been working on doing is setting up governance and structures to build up that supply chain. So we have MOUs with the PNG National Department of Health, and recently we've formed one with UNFPA, the Murray Stopes and family planning ones I talked about. I just want to paint a picture for you. Some of these health centres are very basic. I mean, they are sometimes simply a room, often with no running water, often with no electricity. So I'm trying to get you to imagine what it's like trying to get those supplies down there. It's very challenging.
It's a very remote area from where we are. We have to travel like 2 days to reach that area. And during the awareness, a father came forward to say how he appreciated having his wife getting the implant. The reason was that the implant spaced the years between the kid, the current baby that they have, the current child that they have is like 5 years. And with the implant, it really worked for them. And he really wanted all men to go tell their wives to get the implant as well. Yeah, apart from other options that they're going for, he thought that implant is the best because it worked for the wife.
Even though in Cambodia, so currently there are about 275 cases of COVID, while it hasn't significantly increased for the past few months, the effect of the pandemic is still imminent, especially on the economy. So we've seen a lot of factories have actually closed. So an estimate of more than 130,000 workers from the garment and footwear industry have actually lost their jobs. Also construction workers, where construction projects are actually being stopped. And then also small businesses and shops are also closed because of the slow tourism. So when we see those kind of effects is also affecting a lot in terms of the income of the women in Cambodia. So health, access to health services might not be their priority during this time because of these kind of financial barriers. So we believe that access to information and services on family planning and sexual reproductive health is very, very important, more than ever, and especially during this time. So we at Murray Stopes in Cambodia will not stop unless everyone have access to contraception when they need it.
And obviously in Cambodia, obviously greatly affected by COVID, but has done this rapid pivoting that many people talk about, where you've absolutely embraced new technologies to think, how can we continue to deliver services in these difficult times? And I must say I was very struck as well just around those new technologies, because they come with some pluses and minuses, of course. Obviously it means that you can, young people and older people can connect with services and with credible information, but they can also go down technology rabbit holes as well into all sorts of places that you'd really rather not go. And we know here in Australia as well, but certainly in countries like Cambodia, there's a lot of myths and misperceptions and misconceptions. So helping people to sort out You know, what's evidence-based and what's factual and what's not is a really important thing.
I think it's about educating the people around us about the work that we're doing, and that there still is this unmet need, and we should bring up the next generation to keep going with that message and voice.
And I really thank everyone, our panellists, for bringing those issues to life about what it is like on the ground to provide those services, to provide those sort of, all the things that they do in an amazing way, with all the struggles of technology, the basic issues of being able to access power, mobile phones, things we just take for granted. So they do an amazing job. And I also thank my Women's Plans Foundation colleagues, Alice Oppen in particular, our amazing and inspiring chair. I thank her for her leadership. I thank her for her generosity in bringing this event to us. And I also thank my colleagues Pauline Markwell and Natalie Brandon and the many people who contributed to this event. They've been absolutely amazing in making this event happen. Your donations and support are so important to us. The money you donate, as you've seen, enables us to fund our wonderful NGO partners so that they can do the important work they do for women on the ground. So whether that's funding more outreach health services or patrols in rural PNG, whether that's in-service training for family healthcare providers in family planning to help them do more, or whether it's sexual and reproductive health education for adolescent garment factory workers in Cambodia that Camille talks about. Their work is so important. It empowers and gives women choices and makes a real difference in their lives, their families' lives, their communities, as we've heard today. So my call to action for you today is to donate if you can and join us in this important and inspiring work.